Hi, my name is Todd, if we haven't met yet, and today I'd like to talk to you about dealing with difficult patients. I remember when I first started home care 11 years ago, there was a patient that nobody could keep, and so being the new guy, I was given that patient, and I learned a lot of valuable lessons from working with that patient because I was able to retain that patient for 10 years. He was a suprapubic catheter patient, and he was a very difficult patient. He was very OCD. He liked things just the way he liked them. But it was very interesting that being in his home, I knew exactly where everything was because if you left anything out of place, he would let you know. But anyway, there's about 7 different things that really help me to try to deal with difficult patients, and I'd like to pass that on to you. One is just try to stay calm and professional at all times, even though they hurt your feelings and stuff. It's really hard to bite your tongue, but just staying calm and being professional really helps to go a long ways, because if you get agitated and frustrated, it just fuels the fire and things just they really go downhill. Another thing is, and this is what I do when I go and meet new patients, is the first thing I do is I just sit down, put the tablet away, and just focus on them and just listen to them, listen to what they have to say. And sometimes that helps you to get the full picture without having to ask so many questions, is allowing them to talk, just talk it out. And I found that helps a lot. um, Another one I can think of is setting clear boundaries, that you're the nurse, you're nobody else, you're there to do your job and not do anybody else's job. Because sometimes the longer you are with a patient, sometimes those boundaries get a little blurred, and then they're starting to treat you more like a family member or a servant. And so maintaining those clear boundaries of what you do, what you don't do, and that really helps a lot. um, Another thing is drilling down to the root cause of why they're upset or what's going on in their life. And that kind of goes back to listening, kind of drill down to what the root cause is, and then you can start addressing that problem, and that helps a lot. um, Another thing is involving your care team. You have social worker, you have physical therapy, occupational therapy. If you have a good supervisor that can help dealing with options and things that will help with dealing with a difficult patient. So using your resources, your team, even reaching out to the doctor might be necessary. But realize, even though you're in home care and you feel like you're out there by yourself, you're really not. There is a lot of resources that are at your fingertips, and learning to access them, really helps a lot. One of the most important things, and that's probably trumps everything that I've said here, is your safety. That is the number one priority. And so really trust your gut. If you feel like you're going into a situation that just doesn't feel right, makes you really feel uncomfortable, just remove yourself from the environment. It's not worth it. And I have a very supportive office supervisory staff that is very supportive, that if it doesn't feel right, you get the wrong vibes, and it's just you just feel unsafe, remove yourself. The office will understand. And because taking care of yourself and keeping yourself safe is very important. I know sometimes I go into homes where sometimes there's firearms in the home, or um, dogs become a real issue sometimes. And so being clear up front that it makes you feel unsafe, um, trust your gut. Trust your gut on that for sure. And then practice self-care. This is probably the second one here. Stress. It's really hard on people. And practicing self-care, that, if people, if you don't take care of your self mentally, then you're going to get burned out and you're just not going to last very long. And so learning how to deal with um, the tough things that come along. Think about yourself. Do things that you enjoy outside of work that help calm you down. Learning to uh, do things that help put you in a better frame of mind. And that's probably another big key factor, is really taking care of yourself, keeping yourself mentally uh, in check and shape. I know I'm kind of rambling here, but that is really important. That's kind of the purpose. If you've made it this far, I really appreciate it. But the purpose of this channel here is to do just that, that we can collaborate together, that we can bounce off ideas with each other and really try to help each other get through these tough situations, because home care nursing is not easy. It isn't. And if we band together and help each other out, that's the reason for this channel, is to uh, you know, be a mentor for you. So I hope this helped out. Um, I'm going to put a little PDF in the resource area if you'd like a printed copy of this. And thanks for coming by. Subscribe if you like what you're seeing here, and maybe share it with somebody that could benefit from this. So just appreciate your time, and I hope you have a wonderful day, and see you on the next one.